Hi, I'm Jackie Cardillo of Learning and Development, and I'm here with Dr. Wax and his care team, Rachel and Julie, to talk about the Call Us First campaign for patients. I'm sure all of our medical offices have seen the new signage, and the spirit of this campaign is that we want to coordinate care on behalf of our patients and make sure that they have access to care when they need it. So, Dr. Wax, how does this Call Us First campaign benefit the providers and care team members in the medical offices?
Great question, Jackie. The first thing I wanted to say was it actually benefits the patient. Hopefully the patient can get into our office and not have to go to the emergency room or a walk-in clinic. The way it benefits us in the office, myself and the care team, is that it lets the call come into the office early. I know what my day is going to be like in the staff's day, and therefore I can schedule the patient early, get them seen early, and the medication they need quickly.
That's fantastic. We've also tried to put some options on the table for the care teams to explore in scheduling the patient for same-day care. So that might mean looking at an office nearby or looking at another primary care physician in the office to provide care to that patient. And certainly we have a wide variety of walk-in centers. So with that in mind, Rachel, can you describe a scenario where you've had to follow this? You're like the traffic cop in that front of the house there for Dr. Wax.
Yes, I am. And it starts with when the call comes in and getting all the information from the patient as to what symptoms they're having. That way we can avoid so many callbacks. And as much information I could get is going to help out the clinical staff team. That way she knows how to go to the provider so we can get that patient scheduled right away.
That's awesome. And I'm glad you brought that up because all of these options should be explored with the physician. So it's really the physician that's the decision maker on where that patient should receive care that particular day. Yeah. And so, Julie, let's talk about the back of the house where you are now in the exam rooms. So how has this benefited the patients on your end and the medical offices?
Well, the most important thing, Jackie, is to keep up on the buckets in between the patients. So if we're keeping up on the buckets, then we're able to monitor them, and any sick calls or people that potentially need to be seen that day can be addressed sooner, and it can also help to prevent extra phone calls coming in.
Right. And with that in mind, that would require a very high degree of communication amongst the medical offices. So, Dr. Wax, you're busy seeing patients. So what communication best practices are there when this call comes in or that bucket message comes in and all of a sudden we now have a patient that needs to be seen?
Correct. Obviously, we're all very busy throughout the day. It's hard for us to get through each message in the buckets in the box. So it'll be wonderful when the call comes in if one of the medical assistants knocks on the door, takes 2 seconds out of my day, and tells me the signs and symptoms that a patient's having so we can address their concerns immediately.
That's great. So it's not just electronic communication,
Correct.
but that knocking on the door, calling everyone together, quickly huddling is an efficient way of addressing the
Correct.
needs. Yeah. Yeah. And, I think one of the tough things too, Rachel, is you are working with patients who are wanting to be checked in and that phone is ringing with patients who need to be seen. So what are some best practices that you have for multitasking? So the phone's ringing and you have a patient in front of you to be registered.
Well, first I will ask the patient, I said, will you mind holding so I can take this call? I pick up the phone and I do ask the patient, will you mind holding for me for just one moment? That way I'm not letting the patient in front of me hear information for the patient on the phone.
Yeah, that's great advice. Thank you. And I'm just wondering too, Dr. Wax, you started this whole thing talking about the benefit to patients. So, Julie, have you seen any cases where we were able to really help a patient who needed care in a particular day and they were able to receive it?
So we had a patient walk in a couple weeks ago, and it all started at the front desk. She walked in and wanted to be seen, but it started with Rachel. So Rachel got her symptoms and found out what was going on, and she put the message back, but she put the message back and then also told me so that I didn't have to, it didn't sit and wait until I saw it in the bucket. So we knocked on the door and asked Dr. Wax what he wanted to do, and it worked great for the patient because she was seen, put in a room, worked in at the end of the day, which is when she was there, and it turned out that she had an upper respiratory infection, I think, but she was getting ready to train for a marathon that weekend or to go to a marathon. So she was extremely pleased that she saw her provider instead of going to the walk-in, and that she was treated and feeling better to compete.
It's a great example because in that patient's mind, it was an urgent issue. It wasn't life-threatening, but it was something that in the patient's mind, this is important to me, I need my care today, and you were able to accommodate that. So, Dr. Wax, do you have any final advice for the other medical offices or the call center in terms of addressing these same-day requests?
I think it's a great platform that we're rolling out. It's great for the patient. It gets them to be seen by their provider who is familiar with their care rather than sending them to an urgent care or worse to the emergency room. As we all know, the ER has a lot of sick patients, so we don't want our patients sitting there with these sick, ill patients. And it's great for the team. It hopefully will prevent overtime, get us all out early and on time when we want to be with our families, and make our day run that much smoother.
Well, thank you. I really appreciate your time today, Dr. Wax, Rachel, and Julie. And if you have any questions about this Call Us First campaign, I recommend you talk to your supervisor. And thank you for watching.